So, is Suboxone safe? Yes, Suboxone is safe and effective when used as prescribed under the guidance of a healthcare professional. It is a stable and secure long-acting medication with a ceiling effect. Suboxone, otherwise known as buprenorphine naloxone, remains an underutilized treatment for opiate use disorder despite its efficacy, safety, and relative ease of use. It is an FDA-approved medication commonly used for opiate use disorder. An FDA approval requires rigorous testing, multi-year clinical trials, and extreme quality control. So now let's discuss the two medications, buprenorphine and naloxone. Buprenorphine is a partial agonist opioid that binds to the opiate receptor in the brain, but to a lesser degree than, say, heroin or oxycodone. This decreased binding action actually helps prevent withdrawal symptoms, cravings, and the chances of relapse in your patients. Now, because buprenorphine doesn't fully stimulate the opiate receptor, there's no feeling of a high while taking the medication. Now, this ceiling effect refers to when the medication taken goes above a certain amount, then the effects actually level off so a person does not continue to get higher and higher like other medications. Intoxication or getting high does not occur if the patient is opioid dependent. Now, patients are safe to drive while on their maintenance dose, and cognitive function in patients on their maintenance dose has actually improved compared to other opioid users. The second ingredient, naloxone, which is used with buprenorphine to help discourage misuse, it has no effect. It's not even absorbed when dissolved in the mouth. Instead, it helps prevent medication misuse by causing illness if the medication is, say, injected, smoked, or even snorted. So no matter what, it's always best to use the medication as directed. So here are some recent stats on the safety of Suboxone. Suboxone is classified as an essential medication by the World Health Organization. This list contains medications considered to be the most effective and safe to meet the important needs in a health system. So, the opioid epidemic. Suboxone is estimated to reduce illicit opiate use by even 40%. It also has a very low risk for respiratory depression or cardiac symptoms. This is very important considering opioids, benzos, and other medications that affect the lungs can cause respiratory distress and even death. Then, 3/4 of adults taking buprenorphine do not misuse the drug. And this is in comparison to methadone. Buprenorphine patients had a lower risk of lethal overdose, which again is massive. Now, patients taking buprenorphine and naloxone stayed in treatment much longer than people that were not on buprenorphine and naloxone together. They had lower relapse rates at not only 6 months, but also 1 year of their MAT therapy. So in summary, Suboxone is a safe and effective medication for treating opioid use disorder. Now, of course, it's always good to consult with your clinician to discuss this and then determine what is the best treatment plan for you to see if Suboxone treatment will work.